The silent pandemic. Understanding antimicrobial resistance. Antimicrobial resistance, or AMR, is a growing global health threat. It occurs when bacteria, viruses, fungi, and parasites evolve to resist the medicines designed to kill them. This makes infections harder to treat, increasing the risk of disease spread, severe illness, and death. The World Health Organization has identified AMR as one of the top 10 global health threats facing humanity. The emergence and spread of drug-resistant pathogens are complex and multifaceted. Several factors contribute to this phenomenon, including the overuse and misuse of antibiotics in human and animal health. The lack of access to clean water, sanitation, and hygiene in many parts of the world also contributes to the spread of resistant organisms. AMR poses a significant threat to global health security. Without effective antibiotics, many standard medical procedures, such as surgery, organ transplantation, and cancer chemotherapy, become much riskier. The economic impact of AMR is also substantial, potentially leading to prolonged hospital stays, higher medical costs, and lost productivity. Addressing AMR requires a multi-sectoral approach involving governments, healthcare providers, the pharmaceutical industry, and the public. Key strategies include strengthening infection prevention and control measures, promoting appropriate antimicrobial use, investing in research and development of new antibiotics, and improving sanitation and hygiene. The built environment and AMR, a complex relationship. The design and management of our built environment, particularly in urban areas, play a crucial role in the fight against AMR. Overcrowding, poor ventilation, and inadequate sanitation can create environments where resistant organisms can thrive and spread easily. These factors are often exacerbated in informal settlements and low-income housing, putting residents at increased risk of infection. Urban design can influence AMR transmission in various ways. For instance, the design of hospitals and healthcare facilities is critical in preventing healthcare-associated infections. Poorly designed ventilation systems can facilitate the airborne transmission of resistant pathogens. Similarly, inadequate sanitation and waste management systems can contaminate water sources and contribute to the spread of resistant organisms. Furthermore, the design of public spaces, such as parks, playgrounds, and public transportation, can impact AMR transmission. For example, the lack of hand-washing facilities in public restrooms can increase the risk of infection. Green spaces, while beneficial for overall health and well-being, can also become hotspots for AMR transmission if not adequately managed. Addressing the role of the built environment in AMR requires a holistic approach. This includes improving housing conditions, ensuring adequate ventilation and sanitation in buildings, and promoting hygiene practices in public spaces. Urban planning, a crucial weapon in the fight against AMR. As an advocate for sustainable and health-conscious urban design, I believe that urban planning is a powerful tool in our arsenal against AMR. By prioritizing public health in urban design, we can create environments that are less conducive to the spread of infectious diseases. This involves integrating principles of infection control, hygiene, and public health into all aspects of urban planning. One crucial aspect is ensuring access to clean water and sanitation for all. This includes investing in water treatment facilities, improving sanitation infrastructure, and promoting hygiene education. Another critical area is promoting green spaces and active transportation. Parks and green spaces can improve air quality and promote physical activity, which benefits overall health and reduces the risk of chronic diseases that can make individuals more susceptible to infections. Furthermore, urban planners should prioritize creating walkable neighborhoods that reduce reliance on private vehicles. This not only promotes physical activity, but also reduces air pollution, which has been linked to increased susceptibility to respiratory infections. By incorporating these principles into urban design, we can create healthier and more resilient communities.